So again, the objectives of the 174 study was just to determine time to stability, time to baseline production, and associated risk factors in sow herds infected with PRRS 174. Now I need to note that, again, this is preliminary outlook or look at the data. So with that being said, we're still collecting a lot of diagnostic information, and a few herds have yet to reach stability. So with that being said, we're going to take a look at just the first time to first negative test and associated risk factors. Now I'm going to deviate a little bit from the, I guess, traditional way of giving a presentation. I'm going to jump right to the preliminary conclusions. First off, we found that time to first negative test in a sample cohort of 62 herds had a median of 17.5 weeks. Now, when we take a look and compare that to Dr. Daniel Linares' study, cohort of 61 herds, we found that there was 3.5 weeks shorter in the 174 herds, so for what that's worth. And also we looked at risk factors, gilt source, and percent sows housed individually in stalls were associated with time to first negative test. Again, not necessarily significant. And all other factors that we looked at this time were not associated. Methods. So we invited all the participants from the Swine Health Monitoring Project, as long as they had a 174 infection, to partake in this research project. Of those that were enrolled, we sent off a questionnaire trying to collect herd level information, history of their herd, and some management practices post-detection. Diagnostic data, we asked that they would be submitted at least monthly starting 12 weeks post-detection. This 12-week mark was decided based off of previous research that showed that a majority of herds don't start testing negative until that at least 12 weeks. Production data, we're going to be requesting that here shortly, and so we won't be able to share a time to baseline production quite yet, but stay tuned. Herd inclusion criteria. We looked at farrow to wean herds specifically from the Swine Health Monitoring Project that were confirmed by diagnostics with 174 virus. Again, PCR monitoring monthly, 30 samples, 6 pools of 5. For that first test, we did allow smaller sample size, or of 2 pools. 174 risk factors we looked at least for this study, was region, inventory, so as they were entered into the herd, wean frequency on a weekly basis, gilt source, percent housed individually in stalls, percent rooms that were partially weaned, number of breaks within the last 3 years, including subclinical breaks, herd status at time infection, exposure program, and antigen exposed to both sows and or gilts, and as well as the ongoing management, sows and gilts. So of those enrolled, there was 149. And of those 149, 128 provided questionnaires and diagnostic information so far. So if we take a look at the 128 herds, this was their exposure program. As you can tell, 61 herds, they exposed both their sows and or gilts to MLV, modified live virus. And 31 herds, as you can tell down there, were 31 herds did nothing, no sort of exposure program. And then there was a series of hodgepodge of other mixtures, combinations. But for this preliminary outlook, we just took a look at those 2 exposure programs, 92 herds. Breaking out even further, there were 62 herds that had at least 1 negative test. So the statistical methods used, we ran the univariate analysis using Kruskal-Wallis and Nova for categorical and the Spearman for continuous, and at this time we did not run a multivariate analysis. Now, why do we care about time to first negative test? especially if, some may argue that, well, it may not be necessarily indicative of time to stable. Well, based off of Danielle's work, showed that, well, there was a significant or an interesting correlation between the two. Right here, correlation coefficient is 0.49. So it just suggests that, make sure once you hit that first negative test to not go lax with biosecurity. Now, looking at the distribution of time to first between Danielle's study, top, and the 174 study that I've been working on, you guys may not be able to see those numbers, but the median for the top Danielle study was 21.35 weeks, and for the 174 is 17.5 weeks. Again, this was not statistically significant. Of the potential risk factors that we plugged into the univariate analysis, there was two that kind of jumped out at us. They were interesting. Guilt source is 0.023, and percent sows housed individually in stalls during gestation. Now, taking a look at time to first versus guilt source. Guilt source being it was internal replacements, it was a completely closed herd, and then external, whether it's an on-site or off-site GDU. We found that there was a median of 12 weeks for that internal, which one may speculate, well, maybe it's because it's closed, the virus is able to, get acclimated into the herd at a much sooner time than an external source. Time to first, found that there was an increased percent of time to first as you increase the percentage of sows that are housed individually. Again, someone may speculate, well, if they're housed individually in stalls, they're more confined, the virus will take a little longer to run its course and accumulate within the sow herd. Limitations to the study. Again, we just looked at first negative tests, which may not be indicative of reaching stability. There's a voluntary cohort of herds and not necessarily a randomized sample. Also, there may be some regional bias, and we also didn't look at previous or current exposure to other pathogens at this time. Stay tuned. Again, we're going to still be collecting diagnostic information as well as production information as well to establish time to baseline production. And again, we'll further evaluate those associated risk factors. And also, which we didn't touch base here, but those management practices post-infection to see if that had any sort of influence on time to stability based on production.